Our next speaker is Katie Clark. She is the lead consultant at Clark Health Education and Research Solutions, LLC. She completed her undergraduate studies at Goddard College with a focus on methadone use during pregnancy and audio journalism. During her first semester, she developed and launched the resource website, methadoneandpregnancy.com, and her studies culminated with an audio documentary about illicit drug use during pregnancy and the transition into methadone treatment. In 2013, she graduated from UNC Chapel Hill with a Master of Science in Public Health from the Department of Maternal and Child Health. In 2015, she received her certificate in survey methodology from UNC Chapel Hill. As a consultant, Katie has provided services to nonprofit organizations, state and local governments, and university research projects.
What I'm here to speak about today is some of the work that I've observed, that I've done, and then also some of the work that's been done in North Carolina as far as solutions go. I started my career as a clinician, doing street outreach, working as a counselor, and then I moved into this realm of public health and data. And so what ended up happening is when I look at the issue of drug use during pregnancy, is I really see it through the eyes of both the art of working with these women and these providers, and then also the science. And I think it's really important to be blending these two because the way that we work with people has to be informed by science. We have to deliver it in a way that's going to be appropriate for the women we're working with and also the providers. One of the challenges that I've experienced as a provider in treatment is that there is a hierarchy that happens in treatment. A lot of people think once people get to treatment, everything's fine, you just gotta worry about getting the treatment. But there is a hierarchy and there is stigmatization that happens in treatment, and women and parenting women and pregnant women are particularly hear people saying, oh, I was pregnant, I wouldn't be coming here, and oh, what a good mom she's gonna be. And she hears this from both her fellow patients and also some of the providers even who really don't think that pregnant women should be in medication-assisted treatment. And one of the, and I really love the way that you brought in working with art and the visual arts and storytelling to help with this issue, and I feel like that is really important, which was why I created the audio documentary about 4 women in rural Maine who had been using illicitly and their transition to methadone treatment, because their voices tell the story, and you hear in their voices the agony that they experience and the frustration they have. And what's interesting is one of the women, she is talking about the drug use during pregnancy and how horrible she felt. And what's so interesting is I actually recorded that 2 years after she had been in treatment, but her feelings behind it are still so incredibly strong. So I think figuring out ways of telling stories in creative ways that are engaging for audiences, because the purpose of creating these things is to get people to be aware of it and to recognize the experience of women who have to deal with this in their lives. And with that, I'm always surprised. So I've been running this website, Methadone Pregnancy, for 10 years now. And it's always interesting when I get an email from a woman saying, I just found out I'm pregnant. Sometimes they're already in treatment, and sometimes they're actively using, and they're like, I don't know who I can talk to about this. And they end up giving me their phone number, and I call them like a complete stranger on a website. So what does that say about the support these women have in their everyday lives? That they don't have they don't have anyone to talk to about this that they feel safe with. Sometimes their partner doesn't know that they're in treatment. They're concerned that their partner would be upset if they found out that they were pregnant and in treatment with methadone or Suboxone. And they turn to a complete stranger on the internet. So on one hand, I'm really glad that that resource is there, but on the other hand, again, I'm really concerned that she doesn't have any sort of support in her life. So being sort of aware of that is, I think, really important to the work that we do. I feel like I'm probably preaching to the choir a little bit, but so with part of supporting women is actually supporting providers, because we know that we have providers out there who want to do what's best for their clients, right? but they actually don't know because they don't have access to information. They don't have access of what to say. So one of the things that we worked on in North Carolina is we established a website. It's NCPOEP, so NCPOEP, P-O-E-P. It stands for North Carolina Pregnancy and Opioid Exposure Project. And I believe it's .org, but I couldn't bring it up off the top of my head right now. On that website, so what we did is we created a statewide team of stakeholders who got together and developed messages that are evidence-based for women of childbearing age. And let me back up. We said Pregnancy and Opioid Exposure Project, and we struggle a lot with that word. What were we going to call it? Because some women were dependent, some women identified with addiction, there were women. We also wanted to be inclusive of women in medication-assisted treatment, women who were using illicit opioids, and women who might be getting chronic or even acute opioid treatment for pain. We wanted to create messaging that would work with all of them. So we used the term exposure to kind of cut through that whole addiction dependency, because as I'm sure many of you know, people are like, I'm not addicted, I'm this, I'm that, and again, a lot of that has to do with stigma. So we came up with messaging that for providers to have conversations with women. That included, if you have women that are of childbearing age, having a conversation about birth control, if they're using opiates for whatever reason, if it's for chronic pain, for treating substance use disorder, or if someone is actively using. We also created a list of messages for infant care providers, and infant care providers, and for women of childbearing age, with what do we say to women. So those messages are online. Please feel free to go and look at them. What we also did in North Carolina is Vermont, where my home state, had put out a really fantastic guideline for addressing opioid use during pregnancy. Is anyone familiar with the Vermont guideline? Okay. Thanks, Andrea. Okay, good. So what we did is we contacted the Vermont Department of Health and said, hey, this is a really great resource. Can we actually adapt this for North Carolina? And they were like, absolutely, just give us some credit. So we also don't have to reinvent the wheel. If there are some good products out there, contact the people that created them and ask for permission to give them some credit and then adapt them for your state. The Vermont, you've got to update it with your state's particular information, but a lot of the information there is going to be very similar. So those are two good resources that you can get from the NCPOEP website. And the other thing I think that's important when we talk about women, this is my last point, is women are so vulnerable when it comes to being pregnant in several different situations. But this is particularly true when it comes to power in the system we have to work in. So oftentimes women feel powerless with medical providers, but particularly with social service workers. I have worked with so many women who get told one story and then get told something else, and the hospital staff are saying, she's been here every day, she's not exhibiting any symptoms that would make us concerned. We absolutely want to discharge this baby to this mom as soon as possible. The baby is not having withdrawal symptoms. And for some reason, a social worker comes in and keeps the baby in the hospital, has a medical hold put on the baby, and the mother is so powerless in this situation. And it becomes really frustrating because she's like, during my pregnancy, I didn't use, I was just taking my methadone as prescribed, I wasn't smoking, I went to all my prenatal appointments, she did everything right. And again, the hospital staff are supporting her. So I think we have to be really careful of looking at where she's vulnerable and these power dynamics that happen in our healthcare system and our social service system, to be aware of those and, again, find ways where we can advocate for these women. So thank you very much. Sorry.
Can you say the website again?
Sure, it's NC as in North Carolina, PO as in pregnancy opioids, And then EP as in exposure and pregnancy. And I believe it's .org.